Well, we're about to talk about something that might feel embarrassing, but our next guest says it shouldn't be. It's a common problem for many women as we age. Painful sex, vaginal dryness, bladder leaks. If you suffer from any of these symptoms, you should know that there's help for you. Dr. John Hettiarachchi is with the Charlotte Center for Pelvic Health, and he's helping hundreds of women really get their groove back. Dr. Hettiarachchi, good morning. Thank you so much for being here today.
Thank you, Colleen, for having me.
Yeah, well, let's start with this. So many women, more and more women, especially as they reach menopause, are suffering because of vaginal atrophy. How is this affecting the quality of their lives?
Well, most women are seeing their gynecologists who basically recommend estrogen creams, the cost, the mess, the associated risk factors, and then they basically stop. And what we find is a lot of these women lose intimacy with their partners. They don't want to have any romantic relations. They become celibate. There's been a revolutionary laser that's been produced called the MonaLisa. We've had it in our office for 1.5 years now. And this laser basically revitalizes the vaginal tissue back to health. It'll rebuild the collagen, the lining, recreate the better lubrication, so intimacy can begin again.
So as a result, these women who are coming to see you for this treatment, they're really happy in their marriages again. I mean, they're able to enjoy intimacy with their husbands again, like they were years ago.
Correct. And on top of this, intimacy being one aspect, we're seeing a lot of women with leaking issues, bladder leaking. The buildup of collagen also helps support the bladder better. So women who are coughing and sneezing and running to the bathroom, they're able to get off their pads. Another advantage to this therapy is the pH comes back to a normal acidic range as we recreate the vaginal tissue to a younger age, and lactobacilli come back. So recurrent bladder infections are also stopped. So this laser has really changed women's lives. I've been very fortunate to be one of the early developers and adopters of this technology. Being a urologist, being a surgeon, I've always went to medication and surgery. Now there's an option which is a middle ground, which requires no downtime and is really amazing technology.
Yeah, you're an industry expert on this. You have helped literally hundreds of women with all of these issues. What is it that you hear from your patients over and over again?
The first thing that really struck me was amazing is like, why wouldn't a woman have this done? It's like a vitamin pill. It's helped my marriage get to a better place. So this is what our patients are coming back and telling us. So we have amazing reviews online. You can find us on Real Self. These are actual patients that come and talk to us, have treatments, and the best thing at our practice is I've been doing this for so long now, I've actually perfected the right laser settings for the patient, getting the best results. It may require more than just a laser. We also have other technologies, which is called a THEMIVA, radio frequency therapy for people who are fearful of lasers. We have injectable therapies that are for a more cost-effective approach. So again, I have the full spectrum of treatment options for women.
Right. It's not just this one laser treatment. It's so many. You have so many tools that you can use that can help women get better. And as we mentioned, it's not just about vaginal dryness or painful sex. It's also about incontinence. If you cough, you sneeze, you leak, you've got something that can help.
Correct. Correct.
And I know that you really go to great lengths to listen to your patients. I've interviewed many of your patients in the past, and they all said that you just go the extra mile for them. And I know that that's very important to you.
Right. I think to really understand the woman's needs, you have to spend at least 30 minutes to an hour really understanding how their disease came about, what their issues have been, what's going to get them to the next phase of better care.
What is it that you hear from patients after they've completed their rounds of treatment?
They feel they've got their lives back, and that's really amazing. Without any type of surgery, without any medication, ongoing medication, it can fix and revitalize the pelvic region, which in a woman is like an area that no one really concentrates on, has any options. You know, gynecologists may recommend creams, they may take out the uterus, but as an expert, we're offering something better than that.
I want to let you all know that Dr. Hettiarachchi and his team will be at the Southern Women's Show coming up this weekend. You'll be there to answer questions, offer advice. If you suffer from any of these problems that we mentioned, you should really schedule an appointment for a consultation. Just go in and be evaluated. For more, log on to thepelviccenter.com, thepelviccenter.com, or you can call the number that we'll put up on your screen. It is 704-775-8464. Again, 704-775-8464. And don't forget, I know lots of folks will be out at the Southern Women's Show. And again, you and your team will be out there happy to answer questions. Thank you so much for being here today.
Thank you so much. I hope to see all those ladies, and hopefully I can answer all those questions at the show also.
I think you'll be busy. You'll have a busy booth.
I'm looking forward to it.
Yeah. Well,